You're crouched behind an overturned car, the air thick with smoke. Then a sharp crack echoes. Too close. Your buddy slumps, clutching his side. Blood. Suddenly, the only thing between him and oblivion is you. Hey survivors, welcome back to our channel, the hand-drawn guide to not dying horribly when everything goes to hell. Today, we're sketching exactly how to treat a gunshot wound in the field, so you don't become tomorrow's cautionary tale. Alright, let's get into it. Rule number 1, before anything else, scene safety. You can't save anyone if you become patient too. Make sure the threat is gone or neutralized. Only then do you approach, because in the apocalypse, there's always another bullet with your name on it, right? Now, your buddy is down. What do you see? This isn't a flick where a hero shrugs off a gut shot. This is messy, real. A bullet tears, pulverizes, creates a temporary cavity far larger than its diameter. Often, the exit wound is a gaping, ragged mess. You've got precious minutes, maybe less. We're talking about catastrophic hemorrhage here. That's how quickly life drains. Your priority? Stop the bleed. Your primary directive. Nothing else matters if they're bleeding out. Let's break down the Stop the Bleed toolbox, field style. Technique 1. Direct pressure. Simplest, often surprisingly effective for anything that isn't spurting blood like a geyser. Grab anything, a shirt, bandana, old sock if you must. Press hard, directly on the wound. Use your body weight if needed. Don't peek, don't lift, just press. Keep that pressure on until help arrives or until you transition to something more permanent. Technique 2. Tourniquets. This is for limb wounds, arms, legs. Massive, life-threatening arterial bleeds direct pressure can't control. Picture this. Blood is pumping, soaking through everything. That's your tourniquet moment. A commercial tourniquet is best, but improvised can work. A belt, a strong strip of fabric, anything that won't stretch with a stick or similar sturdy object to twist for leverage. A tourniquet completely restricts blood flow. It's not comfortable, not meant to be. Tighten until the bleeding stops, not just slows, stops. Mark the time you applied it, on the tourniquet itself or the casualty's forehead if you have a marker. Time matters because tissue dies without blood. Ideally, you want to remove it within 2 hours if possible, but in a survival situation, sometimes it's life over limb. Again, this hurts like hell. Your buddy will scream. You'll feel terrible, but your buddy will be alive. Better alive and screaming than quiet and gone, right? Technique 3. Wound packing. For torso, neck, groin wounds, anywhere you can't tourniquet. Literally stuff the wound cavity. I know, barbaric? Yes, it is, but it works. Clean, sterile gauze is ideal, of course, but in the field, anything relatively clean you can pack. Fabric strips, bandages, a clean rag. Push it deep, all the way to the source of the bleeding. The goal is internal pressure. Make a dense, solid plug inside that hole. Then, once packed tight, apply more direct pressure over the packed wound. It's brutal, but it's effective. Finally, what not to do. Don't, under any circumstances, remove an embedded object, a knife or a bullet casing. It could be plugging a vital artery. Stabilize it, tape it down, protect it. Don't go digging for bullets. Unless superficial and clearly visible, you're inviting infection and further damage. Let professionals handle that, if they still exist. And don't try to suck the poison out. You're not a snakebite kit. That's not how bullets work. That's Hollywood garbage. Once the bleed is controlled, you're buying time. Recognize shock, pale skin, rapid pulse, clammy. Keep them warm, hydration if you have it. And understand that without proper medical facilities, infection is a looming threat. Day 3 of the blackout, your buddy isn't just dealing with a bullet hole. They're dealing with no antibiotics and drinking pond water. That's how quickly infection sets in out there. Without antibiotics, infection is often a death sentence. Enjoy your medieval medical care. Bottom line, when the lead starts flying, your speed and willingness to be aggressively decisive are what will save lives, not perfection. That's it for today's page from the Apocalypse Sketchbook. If this helped you survive 5 extra minutes in your head, smash that like button, drop your own tips in the comments, especially the unhinged ones, and subscribe so the next disaster doesn't catch you with your pants down. Stay sharp, stay alive, and I'll see you in the ruins.